Hello everyone, I'm Janda Muhigana and I'm going to talk about different healthcare options and careers that people can go on in the healthcare industry. Healthcare industry is broad and present different career options, and most people think that healthcare profession is all about doctors, pharmacists, nurses and other medical specialists. But this is not the case because you can also get other non-clinical people in the healthcare industry. This is from Aaron MD. To work in each position in healthcare industry, someone needs to have some knowledge in the healthcare sector, but the knowledge and skills depend on the career option the person chooses to do. So here there are three examples I have for non-clinical examples someone can go on in the healthcare sector. The first example is health information managers. These managers follow up and manage the flow of medical records and other patient health information. They make sure that the flow of health information is accurate and proper. He or she needs to have knowledge about medical terminologies, medical laws, and medical coding systems so that he or she works in the line of healthcare. He or she needs to have management skills, computer skills, analytical skills, and able to record and track information. The second example is the medical secretaries who manages information flow within medical offices just as other business offices. Medical secretaries help proper flow of information among other medical officers. He or she needs to have skills about computer and other necessary software they use in the workplace to share information. The third example is the healthcare administrators. They look after a healthcare organization. Main responsibilities of a healthcare administrator are financial management, staff coordination, project planning, and policy and procedure implementation. The administrator should have knowledge and skills about finance, business organization, laws and ethics related to the healthcare sector. After talking about the non-clinical career options someone can have, let's see what is allied health professions. Allied health professions are healthcare providers that deal with identifying, evaluating, and preventing diseases and disorders, dietary and nutritional services, and rehabilitation and health systems management. These allied health professions work hand in hand with other healthcare providers to assess patients' needs, to provide them the proper care and follow-up. Some allied health professions work especially in nutrition, exercise, and other daily activities to advise patients to have healthy lifestyle. They are in two categories. They are what we call technicians and those called technologists. Technicians perform procedures while technologists perform the evaluation and advice section for proper treatment plan to the patients. Some examples of allied health professions, there is audiology. This audiology is the science of hearing, where the audiologist deals with identification and measurement of hearing function and rehabilitate patients with hearing impairment. An audiologist is a professional licensed and specialized in evaluating and treating people with hearing problems. The second example is dietetics. Dietetics is the science of how food and nutrition affect human health. Dietetics is all about reviewing the impact of food that people eat to their health. The dietitian or nutritionist use nutrition education to help people improve their dietary habits to have better health. The third example is the physical therapy. The physical therapists help people to reduce pain and restore their mobility. They use different treatment procedures to help the patients to improve their mobility. They reduce pain, restore function, and prevent any disability. They also use different programs to prevent the loss of mobility by encouraging people to have active lifestyle through doing physical activities. The fourth example is physical assistants. Physical assistants work under the supervision of a doctor or any physician. They have a lot of work about medical practices depending on the workplace setting or state they are working in. They need to have enough education and skills related to medical setting. They mainly help in the diagnosis and treatment plan of a patient, undergoing examination, assisting in a surgical treatment, and other assigned procedures. The fifth example is rehabilitation counseling. This sector deals with mental health professions who work with disabled people to build skills and how to cope with the environment. The sixth example is occupational therapy, where they use a client-centered health profession concerned with promoting health and well-being through occupation. It involves the client in the therapy and helps the client to integrate with his or her daily activities. So after learning about allied health professions, let's lastly go on with some types of nurses. Let's first see what is a licensed practical nurse. It is a medical professional who undergoes different responsibilities under the supervision of a registered nurse or a doctor. A licensed practical nurse works in different settings, could be hospitals, community health centers, physician offices, patient homes, and mostly they work in nursing facilities. A licensed practical nurse should have various skills to approach the patients, like problem solving, interpersonal, and management. A licensed practical nurse should have qualities like flexibility, empathy, patience, and taking responsibilities. So a licensed practical nurse also undergoes different duties depending on the state, but mostly they record vital signs before diagnosis, assess the patient, proceed with other personal care like wound dressing. Some states allow them to prescribe medicine and operate devices like taking lab tests. So to be a licensed practical nurse, someone needs to go to do an accredited community college to pursue a 12-month educational training, and later go on with the licensure exam, or where the state gives him or her the exam to pursue to see if she's eligible. After that, he or she can choose to do more specialization. The second type of nurse is registered nurse. He or she is a graduate trained nurse who has been licensed by the state authority after passing qualifying examination for registration. Registered nurses perform different responsibilities in various forms of medical areas, and responsibilities varies with the state or place of working. For example, a registered nurse works in open hospital, has many hours to work, but the one who works in the physician office has some stated hours to work. Usually, responsibilities of a registered nurse, they are recording and assessing patient information, helping the doctor to take exams and surgery and dress wound. To be a registered nurse, someone needs to pursue an associate degree in nursing or bachelor's of science in nursing, and the person needs to pass a national exam about licensure according to his or her state. Lastly, the last example of a nurse is a nurse practitioner who is a graduate in advanced practical nursing. Nurse practitioners provide different health services and in different specialties than other nurses. Examples of specialties they work in: there's cardiology, geriatrics, pediatrics, psychiatry, and women's health. To be a nurse practitioner, you need to pass a graduate in practice nursing and pass a certification exam. So they pursue different health services, the diagnosis and taking lab tests and other related health services. Thank you very much for your attention.